next MS trial is about personalized extended interval dosing of natalizumab. And natalizumab is a very effective therapy for patients with MS. However, in 94% of patients, drug concentrations are still relatively high in the standard treatment interval of every 4 weeks. Several research groups studied extended interval dosing, where the treatment interval of every 4 weeks is prolonged, and found equally effective suppression of disease activity with a lower risk of potential side effects, such as PML, but also lower healthcare costs. But drug concentrations, even on extended dosing, vary widely between patients, and therefore a personalized approach might be superior to fixed extended intervals. So the aim of the next MS study was to validate the efficacy of personalized natalizumab EID interval dosing by measurement of those drug concentrations. And we did this in a non-randomized multi-center prospective study, which we conducted in 21 hospitals in the Netherlands. And patients were able to participate in 3 non-randomized study groups. The EID 10 group with the target drug concentration of 10 micrograms per milliliter, a subgroup with a lower target of 5, or standard dosing. And we determined the treatment intervals after 2 measurements of those drug concentrations. The primary outcome of the study was radiological disease activity on yearly MRI, comparing the EID 10 group to a historical cohort of standard dosing. But we also looked at several secondary outcomes, such as treatment intervals, MRI disease activity in all groups, EDSS progression, and also some biomarkers such as neurofilament light. We started the study in February 2020, and eventually 376 participants started the study. The median follow-up at the last available follow-up of all groups was 87 weeks. And of our participants, 84% chose for personalized dosing over standard dosing. And most participants were included in the EID 10 group. This was 251. In this group, the median treatment interval at last follow-up was 5 weeks between the infusions, and the treatment intervals ranged between 4 to 8 weeks before reaching the target drug concentration of 10. In the lower subgroup, the group of 5 micrograms per milliliter, we included 65 participants. And in this group, the median treatment interval was a bit longer. This was 6 weeks. And the treatment interval ranged between 4 to 9 weeks before reaching the target drug concentration. So in this group, also about 1/3 of patients was able to extend beyond 6 weeks, so between 7 and 9 weeks. So that's far more than the initially 4 weeks, of course. We also saw no increase in radiological or clinical disease activity in the personalized EID groups compared to standard dosing, and also found that the lower drug concentration of 5 was efficacious compared to the target of 10.